Welcome back to the Ageless Pet Podcast. We're season 2, Dr. Bissoni. Season 2. So we talked about some rehab therapy, and now we're going to talk about something really important in the human and veterinary field, cancer.
Not a fun topic.
Not a fun topic. And we're going to have future episodes on cancer, but this is just some questions that Dr. Kendra Pope, an integrative oncologist, created, and we're going to start with some statistics.
Right.
So 1 in 2 men and 1 in 2.4 women are expected to have a cancer diagnosis at some point in their life.
That's a lot.
That's a lot.
It's almost half of everybody, right? Half of men.
Yeah.
It's just a crazy number.
Yeah.
Think about that.
In 2020, as of 2020, 19.3 million new cancer cases and 10 million cancer deaths were reported.
I think the other statistic, too, that gets me is that cancer surpassed cardiovascular disease as a leading cause of death in 2020. So
yeah.
Either cardiovascular disease treatment is getting really, really good,
Mm-hmm.
or, which I don't think that's the case, or cancer cases have really gone up.
Yeah. They're projecting that by 2030, there will be 26 million new cancer cases and 17 million cancer deaths every year.
That's crazy. Yeah, and certain populations, obviously people who have chronic diseases such as, being overweight or diabetic, cancer is the leading cause of death in these populations. So it's just interesting because we know those are inflammatory conditions, and
right.
So, just stating that inflammation is a big factor there in cancer as well.
Mm-hmm. Chronic inflammation, leading cause, root cause.
Yep.
Cancer is the leading cause of death in dogs and cats as well.
I didn't even know that, to be honest with you, until I read this slide from Kendra. I would have assumed, but I didn't know that was the leading cause of death.
Yeah, it's even higher in dogs than humans. So studies have found that cancer rates are as high as 1 in 3 dogs and 1 in 2.5 cats in their lifetime. So they're getting it more than we are. And it just, what's the why? Why is this happening?
Right.
Why is this happening? There's cancer cases in people under 50 worldwide is up nearly 80% in the past 3 decades.
Right. I think if anyone, that's a crazy number, 80% in cancer and under 50-year-old people. And I think a lot of us, at least I know a lot of people who have been touched by cancer in the young population, so... And you always wonder, you start asking yourself all these questions like, why? Why did that happen? Is it genetics? Is it environment? Or what is it? But it's a crazy number. And, they have this thing that they said that, what do they call it here? A birth cohort effect. Basically saying that, every so often, let's just say, for example, in a decade, the risk of people who get cancer who were born in 1960 is higher than people who were born in the 1950s, and et cetera, and et cetera.
Yeah.
So then the 70s are higher than the 60s, and the 80s are higher than the 70s. And, now we're in 2020-ish. So yeah, that's pretty bananas when you think about those things.
Yeah, and I just wonder, with all of the screening that they do on the human side, the fact that we're still getting these numbers and these deaths, right. I mean, early diagnosis is so important. People are going in, but I do know that some of the recommendations are changing with like mammogram and colonoscopy and all of that. Like they keep going back and forth with how old you should be. And I just wonder how much of this is going to change that recommendation, because the earlier you catch something.
And then also remember that there might be a recommendation to get a colonoscopy once every 5 years. But
right.
If you have a history of colon cancer in your family, you can always request it to be done earlier.
Oh, yeah.
I've seen that as well with either breast cancer or colon cancer or prostate cancer, that the recommendation might be every X years, and your doctor may stick to that, but at the end of the day, you have the choice in your healthcare to decide what to do. And I've seen too many of those cases that people have made those decisions and ended up being to their benefit. They caught something early, and that's the whole thing.
Yeah. And medicine is changing on the human side, where people can pay out of pocket to have CT
right.
and full body MRIs. And it's good, But
Right.
we have to, that's a lot of information to unpack. And so, obviously, if you feel like something is going on with your health or your pet's health, seek out, medical professional. Because what we're talking about is not to give anybody a diagnosis. This is for educational purposes, just to bring awareness to such an important topic.
Right.
So from 2000 to 2012, analyzed global data on 14 cancer types showed increased incidence in adults before the age of 50.
Yeah, that's crazy. And what was that? And amongst that, of the 14 cancer types that are on the rise, 8 were related to digestive system issues. So the food we eat and the microorganisms in our gut are directly affecting these cancers. So of those 14 on the rise, 8 of those are directly related to diet and microbiome disturbances. So,
Yeah, which is not surprising.
Nope.
And it shouldn't be surprising. We did a whole episode last season on the microbiome because it's so important.
I think, for people like you and I who are in this world, it's not surprising. But
Right.
for everybody else, it might be
That's true.
surprising. We're
That's
kind
true.
of nerds,
Yeah.
speaking for myself. But anyways, though, so it's a crazy number.
Yeah. And it's just the numbers going up and up and up, and how much food has changed. Toxins, pesticides in our water, in our air, in our food. I mean,
Well, that's what I wonder with those statistics that we said that in the 1950s versus 60s versus 70s, there's an increase in every year. And why is that? Is it
right.
just the quality of our food? Is it the toxins in our environment? Is it the lack of sleep? Is it the stress? Is it the EMFs? Is it the screen time? Is it, what the hell is it?
Right. And to be clear, because there is a big separation in environment and food, these numbers are U.S. numbers, right? They're probably going to be different in Europe, where they evaluate what goes in the food a little differently. And so
Correct.
I'd be really interested in kind of breaking down the different countries and the different areas.
Fascinating.
Yeah.
Well, like the blue zones, etc. What's going on in Osaka versus, Sardinia versus whatever. I think that would be really interesting. But that's even a hard thing too, right? Because that's genetics and lifestyle and so many other factors. So.
Right. And the diets are so different. They're similar in some things, like Okinawa versus Costa Rica, but there's still differences there.
Different. So, but anyways.
Yeah. So speaking of the U.S., the percent of U.S. dogs with cancer in 2021 was 3.4%. less than approximately 5% prevalence in humans that year. So but if you want to talk about the incidence.
Yeah, it said one of the statistics show that in 2021, the incidence was 2.8% of dogs will have cancer, which is 5 times higher than the 0.57% incidence of newly diagnosed cancers in humans. So that's a lot, 5 times higher. So goes back to how many dogs get cancer and leading cause of death, etc. And 280 times higher than the incidence reported in 2014.
Yeah.
That's a crazy statistic.
Yeah. So, we were talking before how we've both had dogs that have had cancer. And, integrative oncology has come a long way, and it continues to grow and develop. And these are 12 questions that every pet parent should ask their veterinary oncologist. So we're going to kind of just go through some of these. Right. Number 1, what is your overall expectation for your recommended treatment? Are you looking for a cure, palliation, or other? I think this is really important.
Right.
Like, what are we to expect here?
Right. And I think that, unfortunately, I've seen humans, some of my friends who've had cancer, unfortunately, who are even afraid to ask their oncologist what they're doing and what they expect. And that's, I imagine, I haven't been in that position myself, but I'm imagining that that's a scary thing to ask. You know, it's like, am I going to live a year? Am I going to live 10 years? But that's a really important question. I just had another friend who had kidney cancer, and that was removed. And there was a spot in that location, assumed to be a lymph node, that lit up, that was cancer. And he asked the question, and the surgeon said, no, I'm aiming for a cure. This is
Good.
curative. It's
Right.
not like I'm just trying to push this out. And
Right.
it's an important question to ask because, again, very different.
Mm-hmm.
And another thing too, Varco and I were talking earlier too, is that every dog, every cancer, and every situation, and every person in their relationship with their dog, and how anxious their patient is, whether it's a dog or a cat or a bird or a bunny, for example, it's all different, so
Right.
individual. So it's really important that
Yeah. And I
we look
think
at.
emotionally it's important to know, are we looking just to give them comfort, or do we really think we can cure this? And I think anticipatory grief and anticipatory anxiety are so real
Very real.
that I think that's a really important question.
Right.
Yeah.
Agreed. So yeah, cure or palliation or something in between. Number 2 was, what are the possible risks of this treatment, and how will the medical team address these possible adverse consequences?
Right.
So, like we were talking about earlier, common risks are for chemo are GI, right?
Yeah.
Not
Nausea, vomiting, and impotence.
diarrhea.
Yeah.
It's very, very common. And how are you going to handle that? And then, of course, there's a lot of these treatments that might end up causing white blood cells or red blood cells to decrease. And how are you going to monitor that? And how are you going to treat that? And does your treatment change after that? Because I have seen that as well. I'm sure you have, where you're doing a treatment and the dog just doesn't tolerate that treatment. So then you have to decrease the whatever it is. I would say the volume or the mg per kg of the dose of the drug. So that's really important thing to ask too. So risks.
Right.
In
Really
the
good
therapy.
one. And then, are there other treatment options available? What is your second or third line treatment if the first one doesn't work?
Right.
Yeah. Are there other medications? Are there other forms of treatment, radiation, surgery, etc., that would be beneficial in this case?
Yeah, I didn't even talk about radiation and the possible risks, but I have seen some animals who've had radiation therapy who've had some chronic changes secondary to that. And, I remember one that had nasal therapy, nasal radiation, and that dog had chronic rhinitis after that.
Right.
I mean, the dog was alive and did really, really well, but still, that was a factor that they were not expecting.
Right.
And yeah, second or third line, I mean, even for lymphoma, there is, oh my gosh, at least 3 major treatment protocols that we see, and one of them is just prednisone, which is not really a huge treatment, but it may be acceptable for people.
Right.
And then second or third line, I mean, there's other drugs like Palladia that might be okay to use, for this. One of the things that I don't think we talked about earlier too was the fact that we have this question all the time, like, well, will blood work pick up on cancer?
Right. That's true.
Yeah, we didn't talk about that really. It's like, I can't remember the statistic, but it's less than 1% of cancers are picked up by your routine screenings.
Yeah,
so,
everybody assumes that, oh, my blood work's fine, I'm fine, or my patient's fine. It's a very well seen meme, at least on my algorithm, is the person comes out looking decrepit and it says, but doctor, my blood work was normal. And you just look at them and they just look so ill.
Yeah.
Yeah, you're right. That's a great point.
Yeah, and there are some tests that are better. There's a new test called Nu-Q Vet that can pick up some cancers. So that's a good one to ask your vet about. And there are some other ones, but I think one of the companies went out of business, so that's hard. But just don't get a false sense of security with the fact that the blood works were normal.
Right. Yeah.
So that was the treatment options. Number 4 is, how aggressive would you say your approach to treatment is? And some people are more aggressive than others, and some diseases call for more aggressive treatments, right? So,
yeah, and some clients may not be ready for the most aggressive treatment because of the adverse effects it can have.
Yeah, for sure. So that's an important question. So, I mean, all these are important questions, but aggressiveness of this approach, and again, is there another option? And again, going back to the other question, side effects and goals. Goals
Yeah.
are really important. Your goals really matter. It's maybe your dog is 18 years old and 6 months is what you want,
Right.
versus if your dog was 2 years old and had cancer, 6 months probably isn't what you want,
Mm-hmm.
so what do you want? So that's an
Yeah.
important thing.
And then, are there any treatments you cannot provide at this facility that may help my pet? What would you consider doing if your pet had this disease?
Yeah,
That's a hard question.
it is. But the first part of that question of, is there any other treatments that you can't provide, is important, because I don't
Mm-hmm.
know if every oncologist or every doctor period would say that there's another treatment you could do, but we don't offer it at this
Right.
facility.
Right.
So I have seen a few with certain types of lymphoma that people are trying to look at alternative things to do,
Mm-hmm.
and that have been successful but are not commonly available.
Right.
But that's a real question. But getting back to the question of what would you do, it's a loaded question,
It
right?
is. It's so hard. It is. Every situation's different. And as veterinarians, there's a lot that we can do ourselves.
Right.
And so that's a tough one. And we get this question all the
All the
time.
time.
Every healthcare practitioner, what would you do if this was your loved one, right? And I think it's a valid question, because there are times where I'm like, if this was my dog, I wouldn't do it. Or if this is my dog, I would absolutely do it.
Right.
But there's a lot of in between.
Mm-hmm.
It's just not straightforward.
There's a lot in between, and I think if you ask 5 veterinarians, you very well may get 5 different answers, depending on their level of experience,
Right.
what they've done with their pets, their age, what they've seen, and other patients of theirs too. So
Right.
just don't take, if you ask me versus Dr. Varco, it could be very different. So just because you ask me doesn't mean I have all the answers, that's for sure.
Right.
So that's a really important. Just remember that we're all people and we give our answers, but it might be.
Right.
I mean, one, we don't have to pay for some of this stuff. So, a treatment protocol might be anywhere from, I don't know, a few $1,000s to $20,000,
Right.
and that number might be greatly lessened for a veterinarian, or if you have insurance. So that's
Right.
another factor as well. And while this is a little off topic, there's that thing called the internet, or chat GPT or whatever, and every animal is different, every cancer is different, every prognosis is different, location is important for the cancer, and the stage you find it's important.
Right. Did it spread?
Yeah.
Did
So
it not? Yeah.
and that's the thing, like if you have we were just talking about our pets, if you have a hemangiosarcoma in the spleen that already spread, and you go online and say, well, yeah, with this treatment, with this herb, with this surgery, you can get X amount of time, but that didn't take into account if it spread. Did it go
Right.
to the liver? Was it in the mediastinum? Was it in the lymph nodes in the intestines? So what do you have? Did it bleed? Did it not bleed?
And the underlying health of the pet, right?
Right.
Like, does this dog already have kidney disease and, chronic inflammation in their body? They went into it already ill, or was it a dog that was very healthy?
Right.
And this was, I think any cancer diagnosis comes out of left field, but some, you kind of look at the patient and you're like, oh man, I'm not surprised. It's unfortunate. And then others, you're like, where did this even come from? So there are a lot of factors.
So those are the factors that, as a veterinarian, you have to think about when someone asks you what will you do for your pet, and also just a warning when you're going online looking at possible treatments for whatever cancer it might be. You might find this miracle treatment with mistletoe or apricot seed extract or whatever, but
Right.
just remember that what's there is not always the truth and doesn't apply to your dog always. So
Right.
that's kind of an important factor. Was that, what number was that?
That was 5, but like,
that was 5.
we're going right into that with number 6.
Okay, yeah. Number 6 would be the question of what would my pet's course of disease progression be if I choose to do nothing? So that's
Nothing you recommend.
Nothing you recommend.
Yes.
True, that's a good
So
one.
for some people, it is nothing because some people, yeah.
Yeah, so what if my dog has mast cell tumors and they're recommending this treatment or the other treatment? Well, that's fine. Well, what's going to happen if I don't do that?
Right.
Is it going to spread? What is that going to look like?
Right. How much time do I have and what's
Right.
the quality of my dog's life in that time?
Because remember, again, as we were saying, these are individual treatments. Like, I'll give you an example of one of my pets. I had my dog Willow, who at 12 developed nasal cancer. Dog is super, super, super nervous and hates going to the vet. And the treatment course would have been radiation on that area, on the nose. And prognosis was good, but I didn't think 21 days of radiation once a day would have been acceptable for a 12-year-old
it's an
dog.
intense treatment.
It is.
And they have to go under anesthesia, and it's a lot.
So I didn't, and I chose to do something else. I chose to do my holistic therapies, and I would put Willow to sleep when she was 14. So that was an acceptable outcome for me, and I chose to do nothing that they recommended. But again, I'm not recommending that, but it is something to know, like, what's that look like if I did nothing? Is my pet going to be gone in 3 weeks, or is it going to be a year? And what am I going to look at? I mean, can my pet no longer breathe? You know, is he not eating? You know, so these are really important things to look into.
Yeah, and on that is, how does this change if I choose to do the treatment you recommend? What is the survival time and quality of life then?
Right.
Because you really should ask all these questions. Asking if I do nothing that you recommend is not insinuating that you're going to do nothing. But I think it is important to know, if I do nothing and if I do everything that you recommend, what is our possible outcome here?
Right. Yeah, and that's an important question. And I, not to keep bringing up hemangiosarcoma, but it's such a common diagnosis that it's hard, because if you decide to do surgery and chemotherapy, I think the statistics are 6 months to a year. If you decide to do surgery and not chemotherapy, I think it's 3 months to 9 months, or 3 months to 6 months, or something like that. So the chemo is not hugely effective. It's not like you're going to get 3 more years. So then the question is, do you do the chemo or do you not? And that's a totally individual question. But knowing survivability between the two treatment options is important.
And knowing your dog. And knowing your dog. You know, if they're already a finicky eater and have a sensitive GI, you have to take that into account and let your oncologist know, because there are things that they can do preemptively to help mitigate some of that. Doesn't mean you shouldn't do it, but just have the conversation.
I literally had one of those a few weeks ago where the treatment would have most definitely, per the oncologist, caused some GI upset, and this patient is barely hanging on with the GI system. So they decided not to do that treatment. They ended up going to option number 2.
Yeah, which is great.
Yeah. And then number 8 was, what do you plan to do to monitor these therapies and see if they're working, and how often do you do these tests?
And what does that entail? You know, blood work, radiographs, CT. How often do we need to do this? Yeah, ultrasound. There's a lot of different things.
Yeah, so all those things, like, what, all of this, how often are we going to do these tests? And again, is that okay for your pocketbook and your dog and what you want to do emotionally as well? So those are, people don't think about the after, like I just did my 6 weeks of radiation, now what? Yeah. So, but the now what could be important, so, and maybe there is nothing after that, or maybe there's a whole lot more. So that's an important question.
It is. The next question is, how much time is reasonable for me to take to make this decision? So the least amount and the most amount of time. And is there anything concerning about my pet that needs to be addressed now? It's a big diagnosis. It's a big decision, and people just need to sit with it, but they need to know, hey, if I take the weekend, if I take a week, I want to talk to my family, I want to look at my schedule to see if I can make this work. There's so many factors, you should just know the gravity of the situation. Is this something that we need to start right away?
Right.
Or can I just take a few minutes? And I think that's a very good question.
Very good.
You don't want to jump into something so big.
Yeah, I mean, sometimes you have to make a decision
Absolutely.
that day or that hour
Absolutely.
just to save life.
Mm-hmm.
And sometimes, it's like, okay, I got this diagnosis. Like you said, can I take a week?
Right.
Or is that week going to be detrimental?
Right.
I mean, that's really, really important. Another one is, of course, in our line of work here, are integrative therapies. And the question would be a good one to ask your oncologist is, are you open to integrative therapies, and are you willing to work with my integrative oncology expert? There's not a lot of them, but even if you just say integrative doctor,
Right.
are you willing to work? And some oncologists most definitely are, and have seen benefits, and some of them, again, personal opinion, personal experience, are not. So
Right.
if you're looking at doing integrative therapies, then you should know if your oncologist is on board with that.
Absolutely.
Otherwise, you're going to hit, my oncologist says this, my integrative practitioner says this, and they can be diametrically opposed.
Yeah, and ultimately this wastes time, right? And it's confusing.
Causes a lot of stress,
yeah,
too.
it's confusing. It causes stress. Like, what's the right thing? And we see this a lot on the human side too,
Right.
right? Where somebody doesn't want to go, because the human treatments can be so aggressive.
Right.
And somebody may not want to do that for themselves, but then what's the right decision? So I think developing as an integrative veterinarian and as an oncologist, I'm not an oncologist, but an oncologist, I feel like reaching out to the veterinarians in your community and really developing those relationships, because there's certain ones that I refer to all the time. And I think that that's really important. And having that open line of communication, hey, I'm not sure if this treatment protocol goes with what you're doing. Let's talk about it.
Right.
Yeah, I think that's important.
On the opposite note, there are certain oncologists that I do not refer to because of those things. So, but yeah, really important to ask if you plan to do integrative therapies. Now, mind you, too, integrative therapies can be as simple as changing diet.
Right.
So remember that it's not all Chinese herbs, homeopathy, intravenous vitamin C, ozone therapy, all these functional tests that we do. It can be a lot simpler than that. So just remember, that's an important thing, because some oncologists don't even want you to mess with the diet, or they have opposing views on what we would say to do.
Right.
So.
And integrative is east and west, right?
Correct,
like we're using both. So if an oncologist that you work with sees what you do, they're going to know already your basic recommendations and your knowledge base. And then a question to ask is, what experience and training do you have with integrative oncology, nutrition, or integrative medicine in general? Some oncologists have some have none, some have a lot, like Dr. Pope here. So I think it's definitely worth asking. And colleagues, they all know who does what. So you can say, if you don't feel comfortable doing this, is there an oncologist that you know of that does offer these treatments that I can reach out to as well, and bring them in as part of the team? And some of them do telemedicine. So even if they're not in your city or in your state, a lot of them will do some telemedicine consults.
Right. Yeah, and I think, if I'm not mistaken, and maybe things have changed in the last year, but I think there was only 3 integrative oncologists in the country. 2 of them are in California, and one's in New Jersey. Kind of leaves the middle kind of open, the country, I mean. But there may be more, but there's not many. And also, don't get discouraged if your oncologist doesn't have experience. I mean, they went to school, they did a residency, they've done their boards, and none of that stuff included anything about integration. So they spent so much time, likely nearly a decade, if not more, just doing what they're doing. So they know what they're doing. They know their stuff, but they might not know the other stuff.
Right.
And that's okay.
Right.
But as long as they're willing to work with somebody, I think is an important thing. And then the other one is, are you willing to communicate, able and willing to communicate with the entire team and be supportive of my personal decisions for my pet?
So important.
That whole thing, it takes a village, and sometimes it does.
Yeah, you need a team player.
Yeah, you want to have somebody who's willing to reach out and talk. And I mean, gosh, I don't think I've met a specialist who's not willing to, at least talk to the, general practitioner. That would be crazy if they didn't. So,
yeah. And then additional questions that we've kind of
Right.
thrown around outside of this list is get a second opinion, get a third opinion, but there's a line, right? Like, don't keep going to different people to get what you want to hear. Because we see that too. We'll have people come in for a second opinion or a third opinion, and I'm like, oh, wow, this person's been to like 7 different clinics, and I'm reading through the record. Yeah. And then you start getting the people that will go to whoever will give them the answer they want. So I think it's important to get that additional opinion. Like you were saying, we all have different experiences, different training. But it's also like, if you're going to get the second one and then maybe a third as a tiebreaker, do that. But don't keep searching, because at some point you have to put that effort into actually treating.
You got to make a decision.
You've got to make a decision. And decision fatigue is real.
Right.
But you just get all the information and sit down with it and just make a decision.
Yeah, and sometimes you don't have that time, like we talked about. Sometimes you have to make that decision right now and go with the first one. But there are a lot of times when you can have a second opinion within a week or 2.
Oh, yeah.
And it's important to look at. But you do have to make that decision. But I think I see way too often that there isn't a second opinion offered or given. And I'm talking about oncology second opinion. I'm not talking about an integrative approach second opinion.
Right.
I'm talking about going from one hospital to another hospital.
Right.
And saying, yeah, it costs money. I don't know what a specialist consult costs, but maybe around $200, or around there, maybe a little more. But I think the value is tremendous, because everyone has, like you said, different opinions and aggressiveness, etc.
And keep in mind, your second opinion may be exactly the first one too.
Right. Good point.
So it doesn't necessarily mean you're going to get a different recommendation, because with things like cancer, specific tumors, this is what's been studied, this is what we found works, and we've tried the other things. And so sometimes your second opinion is the same as the first. So be ready for that.
And that's a really, really good point. Yeah. And that should give you maybe even more confidence, because now I got 2 of the same ones. Then I'm like, okay, yeah, I probably should do this.
Right.
Versus now I got 2 different ones. Now I'm like, what do I do?
Right.
So that's hard. And then I just ran into this the other day, 2 days ago, I think, or whatever, 3. It's, when do we enter into hospice care versus treatment? Quality of life versus trying to get a cure.
Right.
And that's a hard thing.
Yeah. Hospice is such an amazing thing that we're offering in the veterinary field, and it's been going on for years now, and it's growing. And I think it's incredible. Hospice care is not just euthanasia. Right. There's a lot of palliative care and end-of-life care and comfort and a lot of support for the family. It's not just for the pet. Right. But there's resources on grief counseling and anticipatory grief and caregiver burden. So I think hospice, which we will do an episode on at some point, is so important to consider.
You can't let them just, if your dog is like, you have one day that had a good day and they're eating, next day they don't eat. And then like a week later, it's one good day and 2 bad days. And sometimes the writing is on the wall, what's going to happen, but we need to do things to support them.
Right.
We don't let them starve, don't let them dehydrate to death. And so do we have to give appetite stimulants? Do we have to give pain meds? Do we need to do acupuncture? Is it just a lot of grief counseling and decision of when to do, make a decision?
And I think the quality of life scales play such a critical role here, because I find that people are afraid to take the quality of life scale.
Right.
And I think if you can get a baseline, it gives us the areas that we should really focus on improving. It does not mean that your dog scored this number, that's it. It means, hey, their appetite isn't what it should be. Let's work on nausea. Let's work on appetite stimulant, changing the diet. It can be as easy as changing where and what you feed your pet off of. Dogs will develop food aversion, and you can throw that bowl in the dishwasher and put their food in that bowl. They will not eat it. Put it on a paper plate in a different room, they will eat it. So there's so much that comes with that. Do the quality of life scale. It really gives us an indication of what we need to work on.
Yeah. And to that effect too, if you have the chance, if there's multiple people in the house, if they can all take the quality of
separately.
life
Separately. Yeah, not together.
Yeah. That's what I meant. It's just so that you can look at it, because obviously these are somewhat subjective, right? They're not 100% objective. So the husband or the man might think differently than the woman based on the bond they have for the dog, etc. So trying to be objective and maybe get 2 or 3 people to take that test at separate times, or not related to one another, not looking at each other's tests, I should say, is important. So.
Yeah, and having an open and honest conversation about it. This is what I see when you're gone at work all day. This is what I see when I come home from work. Everybody's experiencing this dog in a different way, and the dog is going to have different relationships. There's Gabor Mate has this wonderful lecture that he talks about each child has a different parent in the same family, because you all experience your parent in a different way based on when you were born, the state that your parents were in at that time. So you could be a family of 4, of 2 kids, 2 parents, and both of those children are going to experience their parents in a different way. And so the same might be for the dog, right? The dog is going to have a different relationship with different people in the household, and they're going to see different things based on their relationship.
Right. It's so true. I just think about when you have your first kid, we're both parents. When you have your first kid, sometimes your economic status isn't as great, and then your second maybe, or your third, or whatever, it might be different. And your parents might have been working 6 days a week, and now they're working 4 days a week, and they had no time for you, and maybe they had some emotional issues or addiction issues, and now they're better. But you're right, it's very different. So it's a really very good point about that. So so the hospice thing is really important.
And we will put this list up on our Ageless Pet Instagram so that you guys can go see it and copy it and have it with you if unfortunately you do get this diagnosis and you do go speak to your primary care, then an oncologist. And these are questions to ask your primary care as well, because a lot of them, if you don't want to go to an oncologist, some people can't, some people don't have it available. These are questions to ask your primary care. Do you work with an oncologist? Do you have an oncologist you can speak to about my case and consult with? Some people don't want to do anything as far as, I don't want to do any treatment, but I'll start steroids. Your primary care needs to know, if you start prednisone, this may change what we can do in the future as far as diagnostics. So have that conversation with the primary care as well.
Yeah. And one of the things for me too that I see a lot is that, first of all, I wish we didn't have to have this discussion. And of course, I wish that none of you have to have this. But with the statistics, we know that half of you will, but I see a lot of guilt in the families. And I really feel bad because, we all do what we do to the best that we can do, and it's hard because the guilt is not really serving you any function at this point. It's just beating you up. And I just, people come in I feel so bad because I fed him this shitty diet and that's what caused it. Well, did it? We don't know.
Right, we don't.
It did. And also, okay, well, you did your best. You're doing what you knew was your best or what you could afford, you know? So, you're there for your buddy and you're there for them, and you're there now. And that's all I can say. And I don't care what that means, either as a parent or as a pet parent or whatever. You're just doing your best with what you have, No one's perfect. Even the people you think are perfect
They're not.
aren't perfect.
Mm-mm.
You know, I don't have very many heroes anymore because I used to idolize people because I thought they were perfect, and they're not. You know,
Perfection does not exist.
no. And I think that's an important thing to realize. We're all on the scale. We're all on a journey. But the guilt thing, I understand it, of course. You know, I was raised Catholic, so
Yeah.
that's a real thing.
That is a real thing.
But at the end of the day, it doesn't help you.
It serves no purpose except to torture and torment you, and that's just not going to be healthy.
It's a lot of negative energy to put on yourself and put on your pet too. So try to just think as positively as you can and not beat yourself up for these things.
Yeah, and take it one step at a time and honor your feelings, right? Like, don't let somebody talk you out of the way you feel. Go through the emotions and then pick yourself up and say, okay, now we're going to figure this out.
Right.
But take a minute, feel your feels. It's a terrible diagnosis. We've both had that.
Multiple times.
And so, yeah, it's just not an easy one. And every day is a gift with your pet. So don't get so caught up in the treatment that you're forgetting to like spend the time and do the things.
That's so important.
Yeah.
I mean, that's pretty powerful what you just said just now, because I think about that and I think about like, oh, my dogs can't go on these long walks anymore because he's getting this therapy, but take him on a safari, you know, just go slow. I mean, I don't care if it takes you 10 minutes, which it used to take me for my little doggy to go 2 blocks. If they're having a good time, and it's important for you to enjoy outside. I had a client the other day who still taking his dog to the beach. Dog can't do what he used to do, but the dog still enjoys the beach. So yeah.
It's so important. It's that social part for the people and the pet. It's taking them out in a stroller, taking them on car rides. There's so many things that you could do. It's just, don't get so caught up in the treatment that you're forgetting why you're doing it.
Forgetting to enjoy, right? Yeah, very, very good info.
Yeah, so bummer of an episode, but I think it's really empowering. I think if you have the information, knowledge is power.
Right.
I was going to do the little jingle, the more you know, but...
What is that jingle?
You know, the more you know. The commercial with the star that goes across the screen.
Yeah, no.
Oh.
You watch too much TV.
No, it's from like when we were kids. You don't remember that from the 80s?
No.
Okay.
I remember I'm only a bill. I'm only a bill.
Oh my, I do remember that, actually. Okay.
All right. I guess we cut this short.
Yeah,
now, so.
Well, thanks for listening, guys. Until next time.
Hopefully it was helpful.
Okay,
Bye.
bye.